recognize the member for Timiskaming-Cochrane.
Thank you, Speaker. It's always an honor to speak in this House. Today, more of a tragedy, I think, on Bill 7. There's one thing I profoundly disagree with the House Leader on. I think every member in this House, regardless of party affiliation, cares about the people of Ontario and wants them to live in Ontario with the best health care possible, regardless of their age or where they live. He accuses the NDP of fear-mongering, but how about we just read the explanatory note into the record, because the explanatory note is somewhat different than the picture that the House Leader is weaving. The bill amends the Fixing Long-Term Care Act 2021 to add a new provision for patients who occupy a bed in a public hospital and are designated by an attending clinician as requiring an alternate level of care. This new provision authorizes certain actions to be carried out without the consent of these patients. That's a key point, without the consent. The actions include having a placement coordinator determine the patient's eligibility for a long-term care home, select a home, and authorize their admission to the home. They also include having certain persons conduct assessments for the purpose of determining a patient's eligibility, requiring the licensee to admit the patient to the home when certain conditions have been met. Certain limitations apply. These actions cannot be performed without first making reasonable efforts to obtain the patient's consent. What is a reasonable effort? If consent is later provided by an ALC patient, the parts of the process that have been consented to must be conducted in accordance with sections 49 to 54. They do stop, however. The section does not, where the government stops, is the section does not authorize the use of restraints in order to carry out the actions of the physical transfer of an ALC patient to a long-term care without their consent. The government House Leader talked about his father-in-law, and I respect the government House Leader. I disagree with his position, but I respect him. When we had to admit my mom into long-term care, it was the hardest decision of our lives. The families are all, it's really tough, and it's really tough for the person. But now, on top of everything else they have to face this hanging over their heads, that if they don't make that decision quickly enough, they potentially could go somewhere else. The government House Leader said, well, it doesn't say anywhere how many kilometers. I agree with that. But it says, in accordance with the geographic restrictions that are prescribed by the regulations. Why aren't they in the bill? Regulations can be changed at any time. Put them in the bill. Right? He accuses us of fear-mongering, yet those what he claims aren't in the bill either. At the most stressful time of a person's life, we all want our parents, our family members in the best place possible. And do any of us really want our family members in ALC? No. We want them to get where they can get the best care. And there are places where they can get the best care. But for many of those places, there's waiting lists. And now, this bill gives the opportunity to say, okay, well, we will give your personal health information to someone that bureaucracy cares about. We will send your personal health information without your consent. We will do many things without your consent. And the last step, you might have to pay some more money if you want to stay in the hospital if you don't like that. That's a pretty big hammer at the end of that process. And you know what? A couple of days ago, I asked a question in the House about someone who was denied a second shower a week through home care. And those are the type of people who end up in ALC. Because I asked that question, you know what? She got her second shower. But that shouldn't come into the House. That community care coordinator, how was that decision made? And now you're asking people to believe that these decisions will all be made without the person's consent. That's a travesty. That is truly a travesty of democracy. Consent is something we should never, ever, a person's health consent should never, ever be given up. And that's why we are totally opposed to this bill, because it doesn't improve people's health.